and other things also. But this session is very power-packed. We have two panelists, very interesting. One is decorated, one has been to many places. So I would like to start with you. Devlina, while research, I found out that you have been to Berlin, you have been to Boston, you have been to many places, and now you are serving as the managing director of Artemis. So what are the global things that you are trying to implement at your hospital? Because since I am the editor of the ET now, so I have found out that your stock is also nearly 1,400% up in last 5 years. So yes. What you are doing that a penny stock has become a real stock?
Thank you, Prashant, and thank you for this invite. And I'll go slightly beyond Artemis Hospitals because it's not today about me or Artemis Hospitals. Of course, I will dovetail it with the discussions that we have today. The concept of today's discussion is revitalizing Indian healthcare. And if, with your permission, I would like to say there, essentially in my mind, there are three cogs in this wheel if you want to revitalize Indian healthcare. And, I am a medical doctor, a radiologist from Lady Hardinge Medical College, Tata Memorial. Then I went abroad, studied at Harvard. So God has been kind that I have had a lot of Indian and international experience. And today we talk about our country, India, and what we need to do as to create a soft power in healthcare. So the three cogs in the wheel, which I am talking about, the first is definitely the availability of healthcare. When we say healthcare, we talk about infra, we talk about people, and then the access to a healthcare facility. Typically all over the world, and there are different timelines. If you want to reach a primary health center, you should be able to reach it within 15 to 20 minutes. If you want to reach a secondary, it has to be between 30 to 45 minutes, and a tertiary care, less than 1.5 hours. So like kind of taking an average and not going into the details of primary, secondary, and tertiary, today, in my opinion, that the biggest problem for us is, and which is basically at the bottom of the pyramid in the rural areas, in tier 3 cities, the access to healthcare. So whether it is infrastructure, whether it is people, whether it is just an ambulance service or the roads, how do you reach? And that government is doing a lot. So in the primary and the secondary areas, we are seeing a lot of improvement. So whether it is improvement in immunization, fall in the infant mortality rate, and so on and so forth. But what continues to bother us today is the availability of tertiary care to the people who are at the bottom of the pyramid. And that needs to be addressed. So today, almost 2.6% of our GDP goes to health. And ideally, 6% GDP is what the world looks at in health for a universal coverage. And I'm sure the government, with its focus on India becoming a soft power in health, increase in allocation of GDP is going to be something which is going to move the access to health. The second cog in the wheel, which we have huge amount of muscle, is the digital health. And so be it telemedicine, teleconsultation, tele-upskilling of paramedics, nurses, upskilling them, whether it is AI for predictive medicine, diagnostics, we have it all. And every third, I would say, startup today is looking at digital health, how to make, digital health accessible. So that's a huge space, and we have a clear advantage. And the third cog in the wheel for becoming a Vishwaguru in healthcare is the research and development in health. And we have huge number of hospitals, huge amount of data, large number of patients. The type of data that we have in India, the West are lining up to buy that data from us. So here I will say that at Artemis Hospital, we have created a separate building for research and development where we have got Indian scientists all back from United States, from Germany and all over the world who are working in a very kind of a very academic environment. We have 3 to 4 patents that we are going to be filing in so that we become a true force and power in terms of healthcare delivery, and all these cogs have to be equally addressed for us to move at the speed that we want to move.
So now I would look to come to you. So Lieutenant General Puri, she spoke about the time frame also, and you have served a different ball game altogether. Armed Forces, you have served as the apex post as a Director General. So, and forces are known for very fast-paced treatment because you don't have any time for this. So, what do you think, what is the key difference between your experience and what you are witnessing in the private hospitals and what you are trying to implement so as to make it much better?
Thank you, Prashant. At the outset, would want to thank the Times Network for having me here this evening. Well, yes, let me begin by saying that it has been my proud privilege to be leading the Armed Forces Medical Service. Let me also say this, that it comes with a huge sense of responsibility because you are the shoulder to the entire armed forces. And it means that you're looking after the health of the Indian military, Army, Navy and Air Force, each with its own peculiarities, each having its own nuances, each having working in different terrain. So talking of Army, look at the Army, whether it's on plain ground, whether it's desert warfare, whether it's high altitude warfare, whether it's mountain warfare, whether it's forest warfare. So it's each terrain throws up different challenges. We as doctors, we adapt, try to analyze, conceptualize what is the terrain, the issues, the problems, the challenges which may come to our soldiers, and then plan, strategize medical care in that terrain. So let me say this, that perhaps one of the most challenging has been high altitude locations like, let's say, the Siachen Glacier, etc. Now, those have been very, very challenging issues. Near Baramulla, Drugmulla, beyond that, you know, when the temperatures are minus 50 and high altitude locations, those are huge challenges that I know that the military goes to the challenge, but the doctors are just not very far behind. So I sincerely believe that we as doctors have evolved, make our medical doctrines based on the theater of war. Now, as you can see, the theaters are changing. War is changing. You've just seen the recently concluded war. There's more of air force, not much of land operations. So based on the type of operations, we change our strategy. What sort of medical help would be required, as those medical doctrines have evolved and continue to evolve to find the right best practices, so to say, as far as medicine is concerned.
Okay. And when we talk about technological innovations, the entire discussion is hollow if we don't talk about AI nowadays. So what is your opinion on AI? Because there are a lot of articles, you might take it as a conspiracy theory that people like Elon Musk and Bill Gates are writing that AI will replace doctors, but some prestigious websites like WebMD, Healthline, NHS.co.uk, Harvard Medicine, they are writing that AI will complement doctors. What's your comment on this?
I absolutely endorse that thought process that AI cannot replace the doctors. AI will give you the machines, whereas the human factor, the doctors, will give you the human touch, the empathy, the compassion, and to move and analyze the machine. So I think AI is, is going to be an integral part of our lives. I have no doubt in that, because the way it has complemented, has improved our work conditions, our ethos, our precision work. We talk of precision medicine today. We talk of predictive medicine. We talk of preventive medicine. We talk of so many algorithms that we are talking about today. I know for certain, having now working in the Apollo ecosystem, a lot is happening as in the AI space, and there are a huge number of algorithms which have come in our workplace, suggesting preventive health, predicting what sort of problems we are likely to have. So when a patient comes in, when he comes for his preventive health checks, he's analyzed in terms of his parameters, his vital parameters, his weight, height, blood pressure, pulse, etc. Investigations, extensive biochemistry as well as hepatological investigations. All that is fed into the AI algorithm, and based on that, the algorithm tells you you are a possible suspect. You may land up either in a chronic kidney disease or a chronic lung disease or a liver fibrosis scenario or a cardiac problem. And also now with AI, you have that, we have coordinated with Microsoft, and they have this HoloLens by which all these parameters are added to this through the AI into the system, and actually you can visualize what is your current status of your heart and what are going to be the problems. So that is the level of AI where it has gone. Now you look at fecal microbiome. They take some sample from your stool, and that microbiome is analyzed. It can help you to diagnose whether you are likely to have metabolic syndrome problems, obesity, diabetes, etc. And what you can do to change your fecal microbiome. So there is so much happening in the AI space. And I'll give you another example which I'm very, very fascinated about, and I thought must share with everybody. What the Apollo ecosystem has done, something very, very interesting, and what we call as connected care, Apollo Connected Care, comprehensive connected care program. What it means is, like at Apollo Indraprastha Hospital, we have ICUs. Patient has come out now from the ICU into a ward. Sometimes the patient, while in the ward, becomes a little dodgy. He becomes, he loses control of his vitals and problems. Each of these patients is wearing a wearable device. The wearable device is monitoring each of these patients through another command center. And that command center, the moment the patient becomes a little wobbly, the command center calls up the intensivist, please look up this patient. And so that the patient doesn't collapse, patient doesn't, there's no code blue or a code orange for this patient, and is rushed back to the ICU or treatment is delivered. Now this has extended not only in the ward, it has now extended to nearby hospitals. Okay. We are also extending this service now to e-ICUs. So this service has become a rage that people are wanting this from us, and this is becoming a huge. So all this thanks to AI, early warning signs, which help us to make early diagnosis.
Devlina, we would like to come to you. So any example like Lieutenant General Puri, which has served as a shot in the arm for doctors at Artemis especially,
yes.
Any real life or practical experience?
So yeah, I think most of the hospitals are on the same page. Like we create what Dr. Puri mentioned, the hospital safety network, when people are wearing wearable devices once they are shifted out of the ICU, so that their shift back to the ICUs is reduced, early warning signs are picked up. So we are also using AI for determining strokes. So what is happening is when we have a stroke network, and we are connected to multiple smaller hospitals where they do not have either an intensive care or neurologist or both, or an interventional neurologist to take care of stroke. So wherever this, so we have a stroke and we are the central nidus for this. So in our network, whenever a patient comes with suspected stroke, the software in their CT scan with the help of AI can predict whether the patient is a candidate for stroke or not, and so that the window period is actually respected. A lot of time it could be a vertigo because of her ear problem, and a lot of time it could be a posterior circulation stroke. So this scan, the brain scan which happens, is fed into an AI system, and the moment we predict that it is an impending stroke, all stops are pulled, the patient is shifted faster than you can imagine, and we go in for anticoagulation and saving lives. So we have launched a program called Samay, which is actually a stroke program, integrated stroke program, which works with our network hospitals to shift the patient the moment we identify there is a problem. The other thing is what we have launched is an Health Kundali. It is basically the next generation sequencing, your genetic next generation sequencing. Along with AI, we are able to predict from the age of 35 to maybe 95 what kind of diseases you are going to be falling prey to, what kind of lifestyle, dietary changes, or what kind of checkups you need to do. So a huge boost in the arm for predictive medicine, that we are using. These are just few of the examples, including the FMT, the fecal microbiome transplantation, identifying super donors to get your gut health well, which is a work going on with our scientists in our scientific labs. So a lot of these activities are going on across, and I think in terms of predictive medicine, in terms of preventive medicine, and complementing what we do, AI is going to be there all through, but definitely not replacing doctors and not replacing the acumen which every physician brings on the table.
Conspiracy theory outrightly rejected from the India's largest news platform.
I don't think so. It was a conspiracy theory. For us, it was never a theory, because we know what we are doing, and we are happy to have more help at hand, and we are hardly threatened, or we don't even give it a second thought, to be honest.
Devlina, one practical challenge. We are talking about a lot of technological innovations, but technology has a certain price tag attached to it.
Right.
And when it becomes heavier on pocket,
Yeah.
it becomes, not reachable for some people.
Yes.
But it is reachable to some people. So what to do, and in terms to make this, luxurious kind of treatment also affordable, luxurious treatment? Because some treatments are luxurious, I know, everybody knows. What's your take on this? So,
very apt question, Prashant. And you have asked the right person. I'm the radiologist. I'm a radiologist. So tech has been in my bloodstream from the time I started practicing. Now there is a myth and there is a reality. And let me first do away with the myth. So we in India, so for instance, we buy an MRI machine from Germany or from the United States, from Siemens or GE or wherever. The place where these MRs are manufactured, if you go for a baseline MRI in Indian rupee, you will be charged 35 to 40,000 rupees. Now, when this machine comes to India and we pay all the duty and the taxes and the shipping and so on and so forth, your baseline MRI costs here anywhere between 5 to 7,000. So what we are doing is we are already aware of how price sensitive the Indian population is, and we are constantly cross-subsidizing. We are bringing in economies of scale. So while in a German or an American center, they do 10 MRIs a day, we do 70 or 75. We sweat the machine harder, but make sure every patient pays that much less. And having said that, what do we compare with? On one side, we have created this whole concept of free healthcare in the public sector. So the moment we compare with the free healthcare, anything that we do will look expensive. But free lunch do not last forever. So we have to find a way. And that's when I say that government and private players should come into a kind of partnership, create a national grid for healthcare delivery so that there is no duplication. We do best at what we do. The government does best at what they do. They cross-subsidize us. We cross-subsidize the patients. And there is always a way forward. So the cost, the world looks at India as a destination for tertiary care because we are 1/10 of United States or the people in the West. We are probably 1/3 or 1/4 of Southeast Asia. But we still find ourselves expensive for two reasons, comparing with the public healthcare system and the affordability. But as we kind of continuously cross-subsidize, as there is insurance penetration, as there is Ayushman Bharat, I am sure there will be larger and larger coverage of people in use of technology. And from our side, we will continuously endeavor to keep the prices lower.
Lieutenant General Puri, your quick take, because I think that bell is buzzing and most likely that is for us.
Yes, so I think, Prashant, I'll just capsule what I'm going to say. As far as cost is concerned, it's a genuine thing, especially in countries like ours. But you see, take an example of COVID. When COVID came, much of the RT-PCR kits that we were saying, ventilators, were being imported. They were so expensive. Just in a very short time, we became indigenous. We started emulating the kits. We started producing the kits. The ventilators were being produced. And the costs came down dramatically. So my thing is, when telemedicine, when it came to this country, it was fairly expensive because of the hardware, the software, etc. But with e-Sanjeevani, when it came during COVID, millions of telemedicine consultations, the costs came down. As the volume increases, the cost will come down. As the expertise improves, the cost will come down. So that is my point number one. I'm actually saying what she just said. But the second point which I'm trying to make is Indian Jugaad. Indian Jugaad mein har cheez ko you can customize. You can pick up the best things and try and make it more economical. And I sincerely believe that would really be the way forward in countries like ours. We can do as well with a similar sort of infrastructure.
Now, just to close this, wrap this up, one quick line, one health tip that you live by and want people to follow from both of you.
So I sincerely...
One liner.
Yeah, so I'll just say, in today's times with so much of inaction, obesity, diabetes, metabolic syndromes, and non-communicable diseases becoming a pandemic, the main thing is to move to physical activity. You must exercise. So my catchword would be keep moving, keep living.
Keep moving, keep living is the takeaway. Your
Exercise and conscious eating. Make sure what you put in your mouth, you're sure what you're eating. Yeah.
Thank you so much. We are getting infinite insights, but time is finite to us. Thank you so much. Thank you to audience as well. Thank you to the panelists also. Thanks.
All right. A wonderful session once again. A lot of fascinating insights came to the surface there. And I'd like for Prashant to please felicitate each of our panelists with a small token of our appreciation, a symbol of our gratitude. Thank you, Dr. Puri. Thank you, Mr. Aggarwal. And thank you, Dr. Devlina. A photo up to capture the moment. And thank you, Prashant, for spearheading that discussion.